Our next speaker is Dr. Salomon Amar from New York Medical College and Touro College of Dental Medicine. He's the Vice President of Research at NYMC and Director of the Office of Research Administration. Dr. Amar holds academic appointments as Professor of Pharmacology and Professor of Microbiology and Immunology at NYMC. In addition, he served as the Senior Vice President for Research Affairs at Touro University and as a Professor of Dental Medicine. He has many titles, as you can see. His research has led to seminal observations in periodontal systemic diseases, especially cardiovascular diseases or obesity, leading to innovative approaches in public health aspects of these diseases. And his talk is entitled Micro-CT and Dental Imaging. And so we welcome you. Thank you so much.
Thank you. Chris, I'm just sorry that my mother, may she rest in peace, is not in the audience to listen to such a generous introduction. Thank you. Originally, I had in mind to present some of the data that we had at the use of micro-CT and the models of obesity, diabetes, and most importantly, the aspect associated with losing bone. In my area, as well as in rheumatoid arthritis, and I think I have a slide on rheumatoid arthritis also, when you lose bone, this is a predictor of disease associated with periodontal disease, but most importantly, the presence of plaque and plaque that is around, and you'll hear your dentist say, brush, floss, brush, and floss, which ended up us a few years ago coining the element or either floss or die because of the cardiovascular implications and so on and so forth. That was the original idea. And as I was a broker for Sarah this morning, this emerged in multiple directions. So, and given my position as an administrator as well as a scientist, I thought I would look at the applications of optical versus 3D and 2D micro-CT in research, and then turn it a little bit at the end. I will present some of the data in dentistry, and then I'll turn it to the audience, hopefully to see what do we have right now at New York Medical College, because this is what I'm focused on. And what I would propose based on what I'm going to be showing associated with that. So the conflict of it, there isn't. However, Reviti is the company that we service our micro-CT. It's a quantum G3 that we have down in the animal facility. Company provided slides for this presentation. And as a result of that, this is my disclosure. So the multimodal preclinical imaging technology that we have are the following. 2D is the optical that everybody knows, and the optical X-ray that allows you to enter the animal, live animal after anesthesia, and you can see where basically the distribution of the lesion is. That's not so sophisticated I mean, even if I touch with my finger in duration of a tumor under the skin of the animal, it's enough for me to localize where it is. I don't need all this. What I would need is the optical by itself, if I can, the optical by itself that we can have. But and the presence of and the distribution of the lung and soft tissue associated with the bone that is now going to be of interest for us to continue and to make sure that we do justice to those phenomena. With the optical, which will give you just a topographical distribution of the lesion, you can now graft a micro-CT or what we call an optical CT, and unfortunately, the computer is just acting out. But with the optical CT, you are able to basically have the two elements, the CT by itself with the remounting on 2D or 3D, but most importantly, a GPS localization of where the tumor is. Within this context, to be completely comprehensive, you can add an ultrasound element that is just here, or to do ultrasound CT that we do classically in cardiovascular. So as as I said earlier, the optical can be either 2D imaging, and you see that this distribution will allow you a geographical distribution of it, or a 3D imaging on high throughput. Why is it high throughput? Because as a result of that, you have a tray that can hold 10 to 15 animals in at the same time, and you see the tray in the bottom of here with the high throughput, and you can immediately have all the animals, control versus experimental, done in a similar manner, exposed to the same thing. So the parameters are not changing, as opposed to what we see later on, that is going to be a limitation. Because of the resolution, you lose on this aspect. When you gain resolution, you lose on this high throughput aspect. So the in vivo imaging portfolio that we have, and we have this kind of machine at New York Medical College, the Quantum G3, that is sophisticated enough, but the resolution becomes so important that you cannot have 10 animals at the same time. It's up to 1 animal at a time. It's a multi-species imaging. Here you have the lungs present, you have the kidneys, you have the bone that can be done, and recently with all the Trulicity, Monjaro, and all those blockbusters that you had, they all used the bone fat distribution for demonstrating to the FDA that the animals have lost the body fat, and most importantly, the aspect of it would be associated with a lung distribution, as you have here, lung and heart function that can be. It gives you gated scanning to correct for motion, low dose for longitudinal. You can do longitudinal studies. You can inject the animal for day 1, and then you follow day 2, day 3. I think I have some pictures for you later on. So the optical imaging with the IV spectrum system is an improved penetration, as I said, but you lose on the high throughput. Tissue attenuation, correction for 3D spatial resolution. What can you image with the IVIS on a 2D or a versus 3D? Some people mentioned this morning, if I remember correctly, the diabetes aspect with the imaging of the islet that can be done. Metabolism also can be done. A gene delivery, you saw the gene delivery this morning. But most importantly, you can follow infection with biomarkers of specifically with some of the microorganisms that you become bioluminescent or with fluorescein associated with a microorganism. And we do that classically in the mouth when you give a bolus of microorganism supposedly and usually associated with periodontal disease, and they lit up into the mouth, and you know exactly where they are. Cancer, immunotherapy, inflammation, Alzheimer. I mentioned arthritis earlier. Drug distribution, drug bio availability, and stem cell that can be done. So last one is the longitudinal monitoring that you can do with an injection of a drug, and then you see how it does later on. Non-invasive quantification that you can do. And finally, all the advantages that are detect and monitor the disease over time and monitor therapeutic effect with the drugs, probe development, biodistribution of the probe, and most important is fast, efficient, cost-effective that we have over here. What kind of animal can use this? Insects, plant, rat, rabbit, basically any type animal. And the tray that I showed you earlier can be enlarged or being made smaller depending on the animal. Obviously, you cannot make put a monkey, even the macaca mulara monkey that they have at Lovelace will not be able to enter. But if you take the head, only the head, you would be able to do either in organ ex vivo type of approach or some of the cells. 3D multimodal is in one instrument for the CT that we have, and you see here significantly the biodistribution and biomaterial associated with this phenomenon. Here also the tumor targeting with nanoparticles that you can have on this machine. And finally, just to in the interest of time, basically the liver toxicity that you can identify on the left picture, specifically for identifying where the intervention is going to happen. Multimodal imaging can take different aspects, as I said earlier to you. Micro-CT only by itself, surface reconstruction after the optical, but it can take bioluminescence, and you see in this panel the bioluminescence aspect with different luciferase probe that are available, or FLIT as a fluorescence that you can have, and this can become more and more sophisticated as we move forward. What can you image with the micro-CT? Bone, fish, as you can see, muscle, vasculature, soft tissue, lung, fat pad, cardiac disease, and so on and so forth. There's someone who made a career of the micro-CT with biomarker distribution of COVID in myocardium, with the famous myocarditis, with the distribution of the virus associated with that. Just to switch gear a little bit, high resolution on every image, ex vivo and in vivo. What do you have here on the top? This is a jaw of a mouse. Yeah, this is it, and you can see. And you have the first and the second molar that you can have. So what do? Basic. Okay. When you deal with the mouse skull, you are able to identify some of the structure. The mouse body can be done this way, but most importantly, for the aspect that I'd like to deal with in a few minutes, is basically the teeth that you have here. With the disease, what you have, you lose the bone attachment. Why? Because as part of the disease, when you go to someone who has periodontal disease and is largely advanced, he goes to the dentist, and it's so advanced that the tooth is mobile. And what do? At that time, you can't do anything. You just have to extract. It's too late. Why is it becoming mobile? Because the bone that is immobilizing the tooth around it dissolves. There's osteoclastogenesis. And as a result of that, the bone resorbs. And what do you measure? How can you use micro-CT in this phenomenon? You are using some landmarks, like this landmark, which is called the cemento-enamel junction. And these landmarks allows you to measure the amount of bone that you have lost over a certain period of time in experimental versus control. And with this, you can be very quantitative, very sophisticated in terms of this. And here, some of the data that we published earlier, and we monitored. Here, this is the tooth by itself without any, when you just differ from the skin that they have. And here, the same sample when you start losing all the bone that exists, as opposed to a normal sample where you haven't lost. The idea here is basically to allow you to determine how is the bone loss going to be measured. And you can see that the bone loss can be significantly measured, and it correlates extremely well with the histology or with the X-ray type of optical that we have over there. More recently, radiation therapy induced damage on rat molar with the quantum. Here, as I showed earlier, you can measure the amount of bone that you lose. And here you can see that with the radiation therapy, on top the radiation therapy with the vessel, on the bottom, after radiation therapy, you lost all the vessels. The applications in the area are numerous. You can mouse leg, high resolution of bone mineral here in the vertebra. It's a pretty nice resolution that you can have. And here with different anatomical function on the bone, on the kidney, infection, cardiac. And you see that as you can go, you can superimpose and progressively you see the visceral fat, the brown fat, and so on and so forth that can be now superimposed into the picture. On the lung, here you can monitor the lung and you can see as you function after being infected or being given a drug that causes lung cancer. You see that the lung becomes very, very shriveled and that you can monitor over time. And I'll finish on visceral fat. I mentioned that already. And just for the interest of time, just to tell you that what we have is this equipment. You have a cassette that can hold an animal, and the same cassette goes on multiple, providing that you buy the equipment from the same company, obviously, and you can image with optical the same animal and take it to micro CT and take it to X-ray and 3D and so on and so forth, for you to be able to have a very important aspect. Just to make you laugh a little bit, it's not a laughable subject. So a few years ago, I don't know if you remember, a few years ago, some time ago, I would say, Hosni Mubarak was the president of Egypt. And he allowed a group to take a portable CT and do the micro-CT on mummies. Yeah. And here you have what the micro-CT can give to you on this aspect of a mummy that was a child. And I'll tell you why. Absolutely. Absolutely. Here is the child. The mummification is on the outside, and you can see that the head has already tilted. The teeth are primary teeth, and they have not emerged. So you can even give the age of that mummy. It died at the age of 5, and not even having the primary tooth. And you can identify some of the structure as they go. I don't have time to go over there, but I thought that I would give you here is the X-ray aspect and the distribution associated with that. With that, I'll conclude. I thought I would make you a little, but the applications of this technology are endless, basically, and this is what I came to discuss with you. Thank you very much.
Thank you very much. There are some images you just can't unsee. Very good. Yes, question.
So those images from the the last images are great. From the micro CT are amazing as well. What is the resolution of the micro CT device? Because I'm looking at the animal's skull, and if it's CT, then you also, I know it's lower contrast, but you have the soft tissue as well. And so I'm just thinking in the brain, what kind of, I mean, if you inject contrast into the tail vein, for example, what kind of vasculature can you see?
I think that you definitely, arterioles, you may not see them, but arteries at the size of the mouse animal, which is arterioles for us, can definitely be identified. That's no question. The truth to this is that Alzheimer's disease is a microvasculature issue, and we can follow that properly in the brain of the animals.
Wow, and wow. So the animals, it can be in vivo.
Oh yeah,
as well?
absolutely. You have a machine that has a nose.
It has a nose.
The nose is connected to nitric oxide, and you basically give the animal the ketamine to induce, nitric oxide to maintain, and
Okay.
as long as they have the nose piece, they are into the what I call the garage. You put the animal inside, and then the system continues, and you wake up the animal at the end. So when I said you monitor the drug by a distribution on day 1, day 2, it's the same animal that comes a multiple function. That's how we identified atherosclerosis in ApoE animals based with microorganisms.
Wow, that's amazing. Well, any other questions?
So in the research that you were describing showing the bone resorption,
Yeah.
what was the independent variable? Did you, they had an infection of some sort?
So
I missed that
one
part.
is an animal that doesn't get the infection at all.
Right,
Okay, and
that was the control.
okay, and the animal that gets the infection could be different type of infection, for example, and a bacteria that usually doesn't cause periodontal disease. I'll give you an example. I don't know if you're familiar with the old bacteriology. Gram-negative bacteria
Yes,
are bad.
yes,
So one of them is called Porphyromonas gingivalis.
I see.
Okay.
Yes,
And we gavage the animal with Porphyromonas gingivalis and they lose bone.
I see,
But you can take Staph aureus,
I see.
but Staph doesn't cause bone loss. You understand?
Yes.
So as a result of that, this is your gold standard that although you give the infection, only the microorganism that is purported giving bone loss and is giving you the bone loss,
I see.
and you can see it, or the animal that doesn't receive anything as a background. But the animal that doesn't receive anything is a difficult control because, okay, you didn't do anything, and
Right.
they don't have periodontal disease, the little man. We create it. So you have to come with a microorganism that either is attenuated, and we have that, the same bad bacteria, or a completely different strep or staph or whatever you want.
I see. I understand. Thank you.